my name is Michelle James. I'm a veterinary neurologist at Angel Animal Medical Center in Boston. And I was asked today to talk to y'all a bit about my journey and path, in the profession I've chosen, as well as how did I get here. Okay, there we go. So I am a veterinary neurologist. So what is that? I did not know what a veterinary neurologist was until I went into veterinary school. So I was not familiar with the ability to specialize in our profession. So it was all, kind of new to me. But for those of you out there who don't know what that is, that's okay. So a veterinary neurologist is a veterinarian who has received anywhere from 4 to 5 additional years of specialized training in the field of veterinary neurology. Veterinary neurology focuses on the medical and surgical treatment and management of neurologic diseases that affect animals. And it usually is predominantly small animals, but we also treat large animals. So that can be equine, food animal like cattle, pigs, and also exotics. So birds and reptiles and our pocket pets. And it is a bit different than our human colleagues in the sense that we do both medical and surgical neurology. So that's one of the things that I really enjoy about the field is the variety that we can see in reference to seeing medical cases, surgical cases, emergency cases, trauma patients, and also, although it's predominantly small animal where I work, in my residency, there was a little bit more variety too, and the ability to work with food animal, equine, and exotic. So it to me is the best field, but I'm a bit biased. We do use a variety of diagnostic tests. So everything from CT and MRI that most people have at least heard of those modalities to electrodiagnostics. So I'm going to go through a little bit about the types of animals we treat, the different diagnostic tests that we use for treatment, and then kind of go through how did I get here. So, as I said before, I'm a veterinary neurologist. There's probably, I want to say now, maybe close to 300 of us. That might be an overestimate. So it's not a saturated field by any means. Most of my colleagues are in more urban areas due to the fact that we typically treat small animal patients, but it's a field that's pretty fun. So example of a couple of the patients that we might see here. See if I can get these videos to work. So these are neurologic patients. So here we have this little Chihuahua on the left. And so when you look at this little dog, you can definitely see that its gait is abnormal. We would characterize that as the cerebellar ataxia. You see she's got this kind of wobbly trunkal sway that you're noticing. And so we'll treat animals that might have intracranial disease or spinal cord disease that affect their mobility. And then this here on the right, this pup here on the right, this pitty mix, there's no video here, but you'll see there's this marked asymmetry to his face. So you might notice his muzzle on his right side is drooped. There's some droopiness. It's a little hard to say in terms of movement without a video to his right eye. He's not able to blink. So this is an animal with facial paralysis. And these disease processes that we can see can be secondary to primary neurologic disease affecting, the brain and spinal cord, but also secondary to metabolic diseases. So, these animals might have hypothyroidism. They might have had a stroke because they have underlying kidney disease. So it's a specialty that allows us, we treat neurologic patients, but we're all under the College of Internal Medicine. That's all those letters you saw at the beginning behind my name. And so it's pretty much putting the puzzle together in terms of looking at the whole body. So how do we find out what's wrong with these patients? The best and the most important diagnostic test we have, to be honest with you, is the neurologic exam. And so that's, observing our patients. You see in this kitty here, that's anisocoria or asymmetry of the pupils. So during a neurologic exam, that allows us really to localize where a problem might be in the brain or spinal cord. And then with our history, go through different different differentials that might be causing that disease process or disease processes that we're worried about rather, and then the diagnostic tests that we can do to diagnose the disease. And then based on that, then we can determine what our treatment options are, prognosis, and so forth. And this is just an example of doing a patellar reflex. and some other spinal reflexes that we do in dogs. So we start off with cranial nerves, we look at mentation, gait, reflexes, spinal pain, and so forth. Some other diagnostics that we use to determine the problem, so to speak, outside of the most important, the diagnostic or the neurologic exam, would be our MRI. So this is an example of an MRI being done at my alma mater, Michigan State, on a horse. And then here's a sagittal view of, so kind of cut right in half of a horse. You notice how small their brain is in comparison to the size of their skull, to their head. But we look for asymmetry in the brain. Down here is actually MRI of a pet. If you notice, there's some changes in this back part of the brain called the cerebellum. That's the part of the brain that's important for all our fine motor skills and movements. So similar to that little chihuahua a few slides back, that was quite wobbly and tremoring. Diseases affecting this part of the brain can cause those kind of characteristic changes in gait. And so in this MRI, we can see in a normal animal versus an affected animal, how those changes can present clinically, but also on MRI. Now, most people are familiar with MRI and CT scan, so imaging diagnostics, but other diagnostics we use are called electrodiagnostics. That's another field of testing that we do, both in human and veterinary medicine. And those are tests that we do that allow us really to evaluate how the muscles and nerves are communicating. And so, a lot of neurology, we focus on the brain and the spinal cord, but our nervous system also includes our peripheral nerves, the nerves coming off of the spinal cord, as well as our muscles and how those muscles and nerves communicate with the neuromuscular junction. And so this is, I'm blanking on the species right now. I think it is a gray-headed flying fox, but it's a type of bat that we can see. I think they're pretty prevalent in Africa. But this bat was actually in a conservatory down in Gainesville when I did my residency, and had damaged his wing. He had what we call a brachial plexus avulsion. So he had a traumatic injury to one of his wings, so that his wing was quite weak and hanging down. And so we used electrodiagnostics to further confirm nerve damage in this particular bat. And we could compare the diagnostic evaluation, electrodiagnostics, the nerve conduction velocity and how the muscles were responding to impulses, to that of a normal bat, to really determine that this poor bat had a brachial plexus avulsion, or trauma to those nerves coming off of the spinal cord high up in the neck that innervate and move the wing. He was able to recover with time and rest and some physical therapy, but this is another test that will use electrodiagnostics to further evaluate the nervous system. It can also be used to assess hearing. We also use machines similar to this to assess for seizure activity, so EEGs, which you might be familiar with, have heard about in people. We don't use them as commonly in animals, but you can. And so once we have done our neurologic exam, done our diagnostic tests, which could range anywhere from lab work to MRI to CAT scan to electrodiagnostics, and we go through our differential list, determine what we believe the problem is, any additional testing we need, and then treatment. And that can be medical management to surgical intervention here. This is one of our previous interns, Dr. Beza, assisting us with brain surgery in a kitty that had a brain tumor. So where do I work exactly? So I work in Boston at a hospital called MSPCA Angel. MSPCA is a nonprofit organization. Our big hospital is in Boston, but we have several satellite hospitals in Waltham, Massachusetts, along the Cape, in Essex, and Methuen. And our goal, we have several arms to our organization. I work in the hospital arm, but I also do a lot of work, or at least assist, in shelter medicine at times when I can. But we have law enforcement, we have our advocacy, who works in reference to laws being built, a lot of lobbying in the state capitol. And so, our hospital, or our organization rather, is quite big in terms of the different things we can do, from shelter to hospital to, law enforcement, community outreach, and lobbying through advocacy. My particular job is 75% clinical. And so most of my time that I spend at work is in the hospital seeing patients on an emergency basis and appointments, doing both medical and surgical neurology, and also advising our colleagues in general practice as needed. And then 25% of my appointment is administrative, specifically to diversity, equity, and inclusion, or DEI in our organization. And so that can mean I'm spending days doing vaccine clinics, as you can see in that picture with that little puppy over there in the top left, to working with establishing new initiatives in our organization, from DEI training to programs getting, elementary, middle school, and high school students into the hospital for shadowing opportunities. So my role in the hospital and the organization has changed over the last 7 years that I've been there, so I can do both clinical and administrative work, which is nice. I really love my clinical work, and that's why I'm a veterinarian, but it is nice to have the ability to impact our policies and how we can help our community and improve diversity in our fields. So how did I get to where I am? So I was born and raised in Jacksonville, Florida. Floridian girl, Floridian girl. I always wanted to be a veterinarian. So I'm one of those people that grew up 5 years old, knew I wanted to be a vet. I did not know at all about all the possibilities that exist in the fields, from clinical medicine to industry, large, small animal research. But I just knew that I wanted to be a veterinarian. I loved working with animals. I loved having pets. I loved, catching turtles and snapping turtles and box turtles when I was a kid in the backyard. And so my parents had me volunteer at the local Humane Society when I was in grade school, which really confirmed that I wanted to continue to work with animals. And Cornell did have a program when I was in high school, a research program for veterinary students of color in high school students. And so I applied for that program and was selected the summer before my senior year of high school, and spent the summer up in Ithaca, New York at Cornell, stayed on the campus and did research in the veterinary school with veterinarians in the animal behavior department. Our focus was on cribbing behavior in horses. So that's a stereotypic behavior we can see if anyone's worked with horses, where they kind of bite on the side of their stall or their paddock and they suck in air. And it can damage some of the farm, but also there's some concern it increases the risk of colic and other things like that. So that's a stereotypic behavior we see in horses. And so my job as a high school student was to go through a lot of video footage of these horses cribbing and see if it was activity they did socially. So looking and see if one horse started in the stall, did the other ones join in, that sort of thing. So it was my first experience working with horses. It was my first experience with research in veterinary medicine, and it had me hooked. So there was no question that I wanted to go on to veterinary school after that experience. So for undergraduate studies, I went to the University of Miami, the U, in Miami, Florida. I majored in neuroscience and I minored in African American studies and chemistry. It's funny, I became a neurologist. That was not my intention. I went into undergrad and I majored in neuroscience because I took a class my first semester. I was undecided, my first semester of undergraduate studies, and I just loved it. It was a neuroscience class. I thought it was great. I was really interested in how the brain works and how your body works, your nervous system. And I declared that as a major, and it turned out that that was something obviously I have a calling for. But I definitely don't think that anyone needs to, major in neuroscience, even if they want to become a veterinary neurologist. It just so happened to line up that way for my path. I was a member of the pre-veterinary club, as well as other, extracurriculars and student government. And I worked at a local small animal practice, a holistic veterinary hospital down the road from University of Miami with Dr. Robert Moran. I was exposed to acupuncture in animals and laser therapy. So definitely my first time, seeing or hearing about those therapeutic modalities. I also volunteered at a local thoroughbred racetrack called a race course, about an hour and a half away from campus, helping a vet there. with some of the thoroughbred racehorses. And then there was a summer program that I did through Michigan State University called Vetward Bound. That was an excellent program. And the way that it was set up is that undergraduate students interested in veterinary medicine who come from an underrepresented group could go to this program, stay at Michigan State for the summer, do rotations throughout the veterinary hospital in different specialties, as well as do some, if you were a rising senior student, do some GRE prep. But it was a great opportunity for me to learn more about veterinary school, the importance of some of the prerequisites that we needed to take, and really working in the clinic hands-on, the different specialties within veterinary medicine, how an exam is done appropriately, presenting cases, following up with patients. So it was great. And so these bottom pictures here, this one in the bottom right under the U is me when I was in Vetward Bound with the anesthesia service, and we were working on a little pony. And the bottom left is actually me working with Dr. Ferran on a little feline patient there. And then I think the top left is our pre-veterinary club at University of Miami. So following veterinary school, so I went from high school to undergraduate studies to vet school. So I didn't take any breaks, just went straight through and finished veterinary school in 2011 from Michigan State in East Lansing, Michigan. There's a picture of my colleagues and I on graduation day. Veterinary school was amazing. It was a very challenging 4 years, but it is everything that I love and wanted to do. I was involved in quite a bit of extracurriculars as well, from different groups like the voice chapter, to equine club, to surgery club. I did a lot of community outreach, was great. So that's one of those bottom pictures is local market that we would do in downtown Detroit, where we do free exams for people in the community. So it was great. So it was awesome. I loved it. I also got to travel a lot. My veterinary journey has allowed me really to see the world. So I went to Honduras one summer. It was a mission trip, but it was more so focused on just medical care, really for the pets as well as the livestock for rural community in the mountains in Honduras. It was a great experience working with small animal, the chickens, birds, pigs, horses, buffalo was awesome. I also did an equine externship for a month in Dubai Equine Hospital in Dubai in UAE. And that was great. So that was working with a lot of thoroughbred and Arabian endurance horses. And so you can see in that bottom right picture is one of the endurance races that I worked at in the desert. We follow the horses in our trucks, administered emergency care as needed. There's obviously, not surprising, some issues with dehydration. So definitely going in and popping in, IV catheters and fluids. Some of these horses had pretty catastrophic injuries that we would see, not necessarily from that track, but from the thoroughbred racetrack. So we did a lot of surgery when I was there. And then that picture underneath, I don't know if my cursor's working, but the picture underneath of me working with this little kid was a open hospital for what's called Vet a Visit. So essentially open house for the veterinary school, where we let kids and adults in the community come in and kind of see what we're about. And so we were working with minimally invasive surgery in this example here. So letting kids use a scope. So it was a great experience. I loved it. We actually did not have a neurologist on staff at Michigan State at the time that I was a vet student, but I did externships with veterinary neurologist, and that's how I determined that was the path I wanted to go down. So we talked about 4 to 5 years of training, and so that usually includes doing rotating internship. Sometimes you do a specialty internship, which I did, and then a residency program. So my rotating internship was at Athens, Georgia, the University of Georgia Veterinary School and Hospital. It was a rotating internship. So I did anesthesia, internal medicine, surgery, oncology, exotics, you name it, I did it. But I also spent most, if not all, of my elective weeks on neurology, which really solidified my decision to continue down my path of specialization. And so that's just a picture of me and my intern mates at the University of Georgia, class of 2012, and one of my Sphinx patients when I was there in the cardiology service. Following my rotating internship, I did a neurology specialty internship. So this was in a year that all I did was neurology. So I worked for the neurology service in Vancouver, Canada. So Vancouver, British Columbia, Canada. So as far away as you can get probably from Georgia. And that was an excellent year. I loved it. I, worked 6 out of 7 days a week in neurology. And, that's all I did day in and day out. I ate, drank, breathed neurology, and it was wonderful. Really strengthened my skills as a clinical neurologist and reinforced my love really of the specialty. Participated in a lot of spinal surgery, which was great. And I also learned to love the outdoors. I grew up in Florida and I liked going outside. But that's where I really fell in love with hiking and then skiing, which I'd never been, exposed to before in my life. So it was a really great year that I spent. And then lastly, on my training path was my residency. That was 3 years. Most residencies are 3 years. There are some that might be a little bit longer if they're combining a PhD or master's, but most specialty residencies in veterinary medicine are 3 years. I spent my residency at the University of Florida in Gainesville, Florida, so Gator. We trained in medical and surgical neurology in small animal, but the residency at Florida is unique. You also have quite a bit of time, or at least a lot of consults and referrals from both large animal and especially zoo medicine and exotics, which is great. And I loved it. I continued research during my residency, which isn't too surprising. So I did a little bit of research in veterinary school, and I had that experience in high school, but did quite a bit in my residency at University of Florida, collaborating with other residents and house officers and faculty in various specialties. We also have a special thing in neurology called brain camp. So during your residency, you get to spend a couple weeks doing very intensive training. It alternates between the United States and Europe, and I was lucky enough that my brain camp was in Bologna, Italy. So it's a really unique opportunity to get to learn with colleagues internationally who are interested in the same field as you. And then during that process, you have to do board exams. And so the way that we do board exams in veterinary medicine is following your second year of residency, you do what's called a qualifier. And this is in internal medicine. So this applies to veterinarians in large animal and small animal who want to do cardiology, internal medicine, oncology, and neurology. And so we do, the qualifier exam, which is really broad testing in the internal medicine realm. And then you do your certifier, which is very specific to your specialty. So once you pass those 2 boards, which I did, then you are a board certified neurologist. And following that, I ended up here in Boston working at MSPC Angel, and I have not left. It was my first job after residency. Very well might be my last as well. I've been here for 7 years and I very much enjoy it and love it. And I'll close up a little bit, see if there's any questions these last few minutes, but these are pictures of some of my mentors. So I think the big thing too that we learn along our path is no one makes it alone. We are a tight-knit community. And I would not be where I am today or the doctor that I am today without some of these faces you see on this page, from Coretta Patterson in my veterinary school. She also was there at Vetward Bound, so she's mentored me since undergrad. Dr. Robert Ferran, the holistic veterinarian in Miami, Florida, who employed me when I was a lowly undergrad student looking to get more vet experience. And then within my specialty, Dr. Sheila Carrera-Justice, who was my mentor throughout my residency, Nick Sharp, who wrote the, book really on veterinary neurology surgery and was my mentor at Canada West, still answers my text today, and Simon Platt, who's a very well-known and well-published veterinary neurologist, who also, any of these people, I call them in the middle of the night or send a text, they're going to answer to help me, whether it be related to veterinary medicine or just life. So they're really a big part of how I got where I am today. So now I'll open it up to any questions. How often is surgery required for neurological conditions in your practice? What is your most memorable case and why did it stick with you? And what advice do you have for balancing a demanding career with personal life? Those are excellent questions. So surgery is a very big part of my practice. Depending on the week, I might do 1 surgery a week to several surgeries within the week. The most common surgery that we do is spinal surgery for disc herniations. I did one just Friday evening on a little dachshund named Cooper that came in unable to stand and walk following a bulging disc in his back. We did surgery following a CT scan on Friday, and yesterday when I went in to check in on him in the afternoon with my 3-year-old, he was up and walking. So it can be very, very rewarding. But it's quite a common thing for us to see. With that being said, there are not as many, but there are medical neurologists. So definitely there's enough caseload in terms of dealing with patients with seizure activity, neuromuscular diseases, chronic pain that can be managed medically, but surgery is a very big part of my career. And it's something I love. Sometimes it's nice to just go in and fix something. One of the more memorable cases I can think of was actually a combination of medicine and surgery. Had a little bulldog puppy that came in that was acutely paralyzed. So had some back pain and all of a sudden couldn't stand up. And when we got into the hospital, he was paralyzed. So had no movement in his back legs. He was so severely affected. He also had lost what we call deep pain or sensation. So if you cranked on his hind limb toes with a hemostat, he felt nothing. So really, really severe spinal cord injury to make him both paralyzed and loss of sensation. We did an MRI of that little bulldog, and it turned out that he had an infection in his spine called discospondylitis. And it was such a severe infection to the point where he essentially had an abscess in his spinal canal that was pushing on his spinal cord and compressing it so much that messages couldn't get up and down his spine. And so he actually needed spinal surgery to decompress his spinal cord, remove that abscess and purulent material, or pus, as some people call it, flush out the area. And then we also did some cultures to make sure that we had him on the right antibiotic therapy. And he had a pretty multi-drug resistant infection to the point where I had to put him on chloramphenicol and rifampin. So those of you who might work in a veterinary hospital or do anything in medical field, those are not common antibiotics for us to use, but that's what our little meatball needed, and he did wonderful. He regained sensation in his little toes within a day after surgery. Within a few weeks, if not less, was up and walking. And after about a year of antibiotic therapy, he's now off antibiotics, but he has done great. He's never looked back. So that was a great case in terms of a combination of, came in through emergency, needed surgery, but also it was some long-term medical management with antibiotic therapy and follow-up. And then last question you have on there, advice for balancing a career with personal life and self-care. I think that's something I'm probably still learning. I'm not going to say I'm an expert at it, but I will say that I have changed my duties in terms of what I do for work to try to help, make sure that I maintain that balance. So I am married. I have 2 children, a 1.5-year-old and a 3.5-year-old. And so for me, it's really important to make sure that I'm balancing, my life as a mom, as a daughter, as a wife, as a sister, with being a veterinarian. Because as much as I love being Dr. James, if God forbid I could never practice, I still have value as a person in the society. And so it's really making sure that you realize that you can't be everything to everyone all the time, but finding the way to balance that. And it's hard. It means sometimes saying no. It means, backing off on some of the things that you like to do so that you can do other things that you like to do. And part of that changing, you saw that I do 75% clinical and 25% administrative. So stepping back just a bit from clinical practice to give myself a little bit more rewarding at times. I can see in administrative work, so allow me work in community practice, helping communities in need who maybe would never come to see me in the veterinary hospital because they might not be able to afford the services we provide. But I'm still a veterinarian, so I can do vaccines. I can talk about preventative care. But also, so having that rewarding component, but also having more set hours that allow me to leave, on time if I need to, so I can get home, spend time with my kids, have, some weekends off, that sort of thing. So I think it's a challenge, but trying to just remember that you are a person outside of veterinary medicine and that you cannot continue to help others if you don't also fill your cup. So it's still, I will say I am still a work in progress. But I will also say that my mentors have been good examples for me in terms of they also have families or activities that they love to do and extracurriculars that have nothing to do with veterinary medicine, and making sure that they honor that in their life has really set them up to be great mentors and role models for me. And I hope that I can continue to do that for others. All right. Are there any other questions? Not seeing any more questions pop up. If y'all have any other questions about being a veterinary neurologist, working in administrative or DEI efforts in veterinary medicine, balancing work and life, by all means, feel free to reach out. You can contact Zach. You can definitely give you my email address. I'm more than happy to answer questions. I didn't get here on my own, so I'm happy to definitely give guidance. But I think the big things I would leave with is just, find something that you love to do in veterinary medicine. And it doesn't always have to be, working with animals and clients day in, day out. There might be other things that you want to do in the field. And making sure you enjoy it. It's supposed to be a fun job, and it's a job, but, making sure you find that passion in the profession that keeps you going, so that you can be here for a long time.